The CEO of the company behind popular diabetes and weight loss drugs Ozempic and Wegovy is being grilled by U.S. senators today. The Senate committee, led by Vermont Senator Bernie Sanders, is arguing that Novo Nordisk is significantly overcharging Americans for its products. CBS News correspondent Nancy Chen has been following this, and she joins us now for an update. So, Nancy, give us some background on this and what's been said in the hearing.
And so many millions of Americans depend on these drugs. Good to see you, Lindsay. This Senate committee is calling on Novo Nordisk to make these weight loss products affordable for Americans. And one of their examples, it highlights the price discrepancy between what Americans are paying for Ozempic compared to what other wealthy nations are. A May report from the committee found that Novo Nordisk charges Americans $969 for Ozempic. Now, in Canada, it costs $155 for the same drug, and that price dwindles to $71 in France and $59 in Germany. Same company, same drug. Sanders told the company's CEO that price drops for these drugs can save lives.
Novo Nordisk has developed game-changing drugs, which, if made affordable, can save the lives of tens of thousands of Americans every year and significantly improve the quality of life of millions more, if made affordable. If not made affordable, Americans throughout this country will needlessly die and suffer.
In response, Novo Nordisk CEO Lars Jørgensen argued it's about the U.S. healthcare system as a whole and that most insured Americans, he says, have access to reduced prices for its weight loss drugs.
We are hard at work in making sure that patients have access via the insurance schemes. And today, 80% of all Americans with insurance have access to these medicines at $25 or less for a month's supply. So it's a price point at the pharmacy counter we have to talk about.
Sanders also announced a move that would make it easier for Novo Nordisk to lower its prices. He said that major pharmaceutical middlemen have agreed not to penalize the company for cutting prices for its weight loss drugs. A Yale study published in JAMA earlier this year found the drugs could likely be manufactured for prices far below current prices, as little as under $5 a month, Lindsay.
I wrote it down because I'm shook right now. I mean, $969 in the U.S., $59 a month in Germany.
It's a huge discrepancy.
Wow. Thank you so much for covering this for us.